Hi, we're EmNet and we're building a distributed network of on-call medical responders. While researching in India, we were shocked when Shiv Shakti ambulance service told us that if you book an ambulance a day in advance, they'll be sure to arrive on time. This best exemplifies how delayed ambulances in urban India are. Many of them are unable to reach their patients on time, preventing the provision of critical care in the so-called golden window of medical treatment, the first 5 to 10 minutes after a medical emergency occurs. Currently in India, cardiovascular disease is an epidemic with 55.4 million sufferers. These individuals are most at risk of cardiac arrest. Unfortunately, due to significant ambulance delays, many cardiac arrest patients are unable to receive critical CPR care in time. The National Crime Records Bureau recorded that this leads to 5,000 deaths every day in India.
CPR is an emergency procedure that can help save a person's life if their breathing or heart stops, and it requires no additional equipment. Thus, we present our solution, EmNet. It's a distributed network of on-call responders who will act to prevent any life-threatening situations from unfolding in a majority of households in India. How this works is that individuals at a high risk of developing a heart-related disease sign up on our patient-facing application ahead of time, inputting their insurance and familial history. At the time of an emergency, they request help with the same application. EmNet then assesses the situation based on location and scientific data and alerts qualified locals who have signed up to be emergency responders and are close to the patient. Here we have a working model of the responder platform to EmNet. When an emergency is presented, they receive notification on their phone, at which point they can choose to accept or decline to attend it. If they accept, they receive directions to the patient, which we aim to be under 10 minutes.
We've chosen Mumbai, India as our target market. Mumbai is appealing partially because it is so densely populated that the ambulances in the city are especially vulnerable to congestion traps. Not only that, but as a function of its high density, the city boasts an average of 413 CPR-trained individuals per square kilometer. We expect that we will be able to capture and service the urban emergency cardiac patients in Mumbai, India. This itself is a 4 crore or $40 million market. Our primary customer segment is at-risk patients suffering from cardiovascular diseases. As we continue to expand, we hope to reach other high-risk patients who would benefit from immediate help on the field. To reach this market, we plan to not only pursue the traditional marketing channels, but we also hope to form strategic partnerships with institutions who have unique and direct communication lines with the exact sector of patients we are seeking to capture.
We believe that we have a large customer base, as 10% of deaths in India are due to sudden cardiac arrest, with 20% of these patients losing their life due to delays in arriving at the hospital. We've also connected with several Red Cross and First Aid training facilities based in Indian cities, as they'll be suppliers of the medical training and experience for many first responders participating in EmNet. Our two primary competitors are PulsePoint and Good Sam. Although they provide similar services, since PulsePoint is based in the US and Good Sam is based in the UK, they operate in countries with far more organized emergency response systems than India. India presents more of a pressing issue due to the decentralized nature of the ambulance system. PulsePoint and Good Sam also do not offer any monetary incentive for emergency responders, whereas EmNet does, attracting a larger responder base.
EmNet will employ a transaction-based model. We will charge a flat fee of 2,500 rupees each time a cardiac patient uses our service. Responders will be adequately compensated for and take a portion of this fee. Most Indian health insurers will cover up to 5,000 rupees for ambulance fees, and we believe that our service will be deductible as well. We're looking for $30,000 for our initial proof of concept in Mumbai. We will use these funds to develop our application, fund our marketing campaign, pay our responders, and hire validators to perform background checks. We project that we will break even by end of year 2023 and have a 10x return on our investment by 2025.
We've connected with several professionals who are experienced in a relevant field and have worked in a similar market as ours. Our mentors include Anshul Gupta, Shikhar Agarwal, and Shafi Mathur.
Thank you.